Now look at a very sensitive topic again, and this is the causes of irrational use of drugs. Causes of irrational use of drugs. So when you say a drug is used irrationally, it simply means a patient is using the drug and they weren't prescribed to them. They just bought this drug by themselves, or sometimes the drug was prescribed but the patient tend to what? Ignore the prescription and take the drug as they like. Do you understand? So two things are involved. So irrational use of drug, in a summary, it just refers to situations where medicines are prescribed, dispensed, and consumed in ways that are not medically appropriate. So it could be that it was prescribed or it was not taken accurately. It could be that it was not even prescribed, the patient got it by themselves. So it's a major challenge in what? Health systems, and it actually contributes to poor health outcomes, because most of those patients that use drugs anyhow, their systems could actually develop resistance to those drugs, and when the drug is now prescribed legally to you, it's still not working. Okay, so causes of it could be the prescriber-related factors. So lack of what? Adherence to standard treatment guidelines. So inadequate training. It could be that the person doesn't really know the drug, wasn't reading their books when they were in class, right? So now they are practicing and they are making errors. Also, influence of pharmaceutical marketing and promotions. Okay, sometimes because the patient is what? Pushing you too much, you just say, okay, let me just prescribe the drug for the patient. That's not right. Patient-related factors. All right, self-medication. The patient is just getting the drug by themselves, and probably the patient is feeling that stronger drugs are always better, so they always go and get some crazy drugs like that, And the pharmacy person, so is selling drugs to a patient that didn't bring a prescription sheet. Okay, so health system factors like absence or weak implementation of essential drug lists and treatment guidelines, inadequate drug supply systems leading to inappropriate substitutions, lack of monitoring and evaluation of what? Prescription practices, weak regulation of pharmaceutical promotion and sales. So anybody in the community is owning pharmacies. Like in Africa, somebody that has money and wants to open a shop could casually open a pharmacy without having a pharmacology, certificate or being a medical professional. They casually open it for business. So socio-economic and cultural factors. So poverty could lead to incomplete treatment courses. So patient just abruptly stops treatment simply because they don't have money again. And sometimes people feel like their traditional medicines are better than the modern drugs. So pharmaceutical market factors, aggressive marketing by drug companies influences prescribers and patients. Sometimes there are drugs that are better than some particular drugs, but the other drug, you are always seeing it on adverts, so you go for it regardless, So sometimes same drug can be having about 50 brand names, and you are always confused on which one to go for. So why we look at this is what? It could actually lead to what? Resistance. So a patient is taking a drug and it's not proper. So sometimes the microorganism is not killed, rather they are reinforced. Causes adverse drug reactions and treatment failures, wastes scarce health resources, and undermines the trust in the health system.